sono canti che ascoltato già, desideri che attraverso i
Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening, dear viewers. Welcome to Harmony of Life. Brand new episode here today, of course, broadcasting to you live from, of course, our studios in Riyadh, the Ministry of Culture and Information. As always, brand new subjects, topics, and of course, team guests, which we'll be mentioning. But before I go ahead, of course, and mention our guests and topics of the day, let me first of all welcome my colleague Camille. Camille, good evening. Nice to be here today.
Good evening, Waleed, and great to be here again with you again this evening. And salam alaikum and welcome to everybody joining us this evening for the last night of this week of the Harmony of Life. But our program this evening, of course, we're going to have two different topics. Now, first topic, we'll be talking to Dr. Safia Al-Sharbini, who is going to talk to us about diabetes and the diabetes awareness program.
Definitely, of course, very interesting topic, important at the same time as diabetes definitely is spread out a lot currently here in the kingdom, and I think even on the international society. Of course, our second topic, which will be palliative care, we're going to have Dr. Muhammad Abu Sauda, consultant pain and palliative care, of course, founder of palliative care at King Fahd Medical City, ex-chairman of palliative care, director of continuous professional development administration, and a bit also an important topic which of course we'll be mentioning and introducing both topics to you, of course, here today, and speaking about them, of course, and asking lots of questions to our esteemed guests also today about them. Let's go, of course, briefly and fastly to see what's going on with our tweets. After that, we'll be right back, so stay tuned.
Welcome back, everyone. And those were your tweets today about the coronavirus. And the coronavirus, there are many different types of coronavirus. And the antibodies from one type will not protect you from another type. The incubation period of the virus, meaning the time it's in the body before the symptoms appear, is usually 2 to 4 days. And the infection caused by the human coronavirus is usually mild. A relatively small amount of information is known about human coronaviruses because most of them do not grow in cultured cells, making it difficult for us to study them. The SARS outbreak in 2002 was believed to be caused by a new type of coronavirus that was similar to the one that affects cats. And due to its contagious nature, SARS became a world epidemic, spreading to 32 countries and infecting over nearly 9,000 people. Many of the people who contracted SARS also developed pneumonia, and over 800 people died as a result of the SARS virus.
Of course, and continuing, of course, telling more about, of course, the virus itself, as it have, of course, it's a group of viruses that infect, of course, the tract of both humans and animals. Some coronavirus also affect the digestive system. The virus has a crown-like, of course, projection on its surface, which is how to get the name. There are many different species of the virus. The human coronavirus was discovered back in 1965 and accounts for 10% to 30% of common colds. It affects all ages groups, and of course it's most common during the winter and the early spring. In young children and older people, of course, also the human coronavirus can affect the lower respiratory tract as well. Many people get coronavirus for a second time within 4 months after having it the first time. Scientists believe that this is because, of course, the antibodies created to fight the coronavirus only protects a person for 4 months. Definitely, of course, a very, let me say, serious, I would think, virus. But hopefully, I mean, I only think we heard about it recently. I mean, not most of us actually were, it's not a very common, let me say, of course, virus, but it was discovered back in 1965. And as it says here, of course, for, of course, 10%, 30% for common colds are affected, of course, by it. And you're most usually to get it, of course, after 4 months of getting it the first time, such viruses. But definitely, I think a virus, actually, we should learn more about it and understand more about it, because especially hits you in the winter and, of course, the start of the spring. Let's take a small report. After that, we'll be right back with our guests, so stay tuned.
Incidence and prevalence of diabetes in our society.
So what is the now, sir, prevalence?
Our prevalence is that across all age groups it's 14.1, and above the age of 30 it's 28%.
Do you think with this a huge number of diabetic people, we need to build a new diabetic centers?
I think we have studied our diabetic centers very carefully. We have 20. If we need, we will increase. But the most important is that we will make our primary healthcare centers our centers for treatment, inshallah. Thank you.
Thank you, sir.
Sure. My name is Robert Ford. I'm the Vice President at Abbott Diabetes Care, which is a division from Abbott Laboratories based in California, which focuses on the discovery and the development of glucose monitoring solutions.
Fantastic. Well, welcome with us, Mr. Robert. Can you tell us about the importance of this conference?
This is a really important step. I mean, diabetes is growing at alarming rates, and we are proud to partner with the MOH here in Saudi to be able to develop and implement this program. So many programs, don't really kind of take the necessary steps in it. I'm very proud that the Kingdom of Saudi Arabia, the Ministry of Health, have kind of really put the resources and the focus behind addressing this growing issue of diabetes.
Welcome back, everyone. And that was our first report of the evening about the Saudi National Diabetes Awareness Program that's currently going on. And with us to talk about the Saudi National Diabetes Program, we're pleased to welcome Dr. Safia Al-Shabini, who's an endocrinologist and diabetes consultant. Welcome, Doctor.
Thank you.
Thank you for being with us this evening. So, Doctor, before we start talking about the program, if you could perhaps tell us what is the percentage of diabetes that we're facing here in the Kingdom?
The overall prevalence is about 14 to 17%, but if we take people above the age of 30, then it is very high. It's more than 28% of people above 30 years of age are affected by diabetes.
And so also the other thing, doctor, there's two different types of diabetes, type 1 and type 2. Which are we seeing more of?
It's all over the world. Type 2 is more than 90% of diabetic people have type 2 diabetes. And type 1 usually it appears usually in children. And the peak of the prevalence is at the age of 12 to 14. So the highest number affected by type 1 is at the age of 12 to 18. Fortunately, it is very low incidence, it's less than 10% of the population. In type 1, what happens is that we have the pancreas, which has cells, we call it beta cells. The beta cells are the manufacturer, and they form the insulin and produce the insulin in response to the level of blood glucose, blood sugar in the blood. In type 1, what happens, these cells are destroyed, so they do not produce insulin anymore, and the child needs insulin for life. Type 2, the beta cells are not destroyed completely. They produce some sort of insulin, but the amount of insulin produced may be less than the need of the body, or sometimes it is the amount is good, but the insulin does not work properly. So that is type 2, and usually type 2 affect the adult people.
Interesting. Of course, before I ask you about, let me say, the awareness campaign or the awareness program, what I would like to ask you is that, of course, when I always hear someone who has diabetes, I rarely even hear someone say, well, I used to have diabetes, now I don't. When it hits you, it comes with you into life. You just have to program your life, for example, on a different sort of diet, physical exercise, what you eat, as you mentioned, of course, insulin. Is it possible for a person to, who has diabetes, to after injections with medicine, with exercise, for the diabetes to go away? Or when it hits the body, that's it, as you mentioned, doesn't go away?
Yeah, it's possible in type 2, but not type 1. Just imagine that you have a manufacturing industry, and the industry is producing insulin, but it is knocked out. So that is in type 1. So they have to have insulin all over. But in type 2, because we have different mechanisms and different factors contributing to type 2 diabetes, so there is a big chance that it might go into what we call remission, a remission that when the disease is quiescent, it doesn't appear anymore. And that has been approved by several studies, that we know that obesity is one of the major contributing factors for type 2 diabetes. So if the person reduces weight, either by lifestyle changes or even by surgery, sometimes when the obesity, when the weight is so huge, we intervene with the surgery. So it has been shown that if they reduce weight, the diabetes may disappear. And it happens that several people affected by diabetes, they might not need even medication. So, and that's why the awareness is very important, because it can go into remission.
Sure. Well, let us mention this awareness program. First of all, I would like to know about it, more details about it. When did it start? How long is it going to go? And what does it aim exactly? For example, where is it going to be? How can also the people, for example, participate and benefit from, of course?
It's an awareness, community awareness program. The aim of the program is to increase the awareness and educate people about diabetes, diabetes is a big problem all over the world. It's not only in Saudi Arabia, and the prevalence is increasing all over the world year after year. More people are diagnosed with diabetes. So the aim of the program is to educate people about the disease, that the disease can be controlled, the complication of the disease can be prevented, and we need the participation of those affected by diabetes to make the control is more effective. Being a doctor or a medical practitioner cannot work alone, because big part of it is lifestyle changes. So for lifestyle changes, I need the participation of people to control the disease, and not only to control disease, also to prevent the appearance of diabetes. And the program is going to run over 3 years. It has been launched only a few weeks ago by His Excellency Dr. Abdullah Rabia. And they're going to use different media for the awareness and different campaign for awareness.
Well, definitely this is a very important program to spread awareness to the community about the effects of diabetes. And we've got a lot more questions for you, Dr. Safia, but for now we're going to take a small report, and then we'll be back with Dr. Safia Al-Sharbini, so stay tuned.
Welcome back, dear viewers, of course, to Harmony of Life. As we just saw, of course, the interesting movie, which spoke, of course, about statistics numbers, of course, of about diabetes in the international side in general. But of course, back with our very respected esteemed guest, Dr. Safia Al-Sharbini. Doctor, we were just mentioning the awareness, of course, program, and of course, how long it's going to be, who's it. Where is it going to be, of course, and who's it going to aim exactly. But speaking about diabetes in general, I think if we mention, especially here in the Kingdom, as I mentioned also, for example, under the air, that it's almost in each house, you see huge numbers of people affected by diabetes, whether it was type 1 or type 2, of course. Let me say such campaigns, for example, how is it going to help our new generation, at least, of course, to avoid the risk of getting diabetes, whether, of course, it was by genetics or whether even, of course, by unhealthy lifestyle which of course will lead to diabetes?
Yeah, for diabetes, there are some factors which can be modified, some factors which cannot be modified. For example, age, nobody can change his age. But those people, certain factor like sedentary life, like unhealthy food, like obesity and overweight, these are the factor which can be modified. If we want to prevent diabetes, if a person wants to avoid diabetes, for example, they have a first-degree relative in the family who have type 2 diabetes. So that person should avoid obesity, and if they're obese, they try to reduce weight to the near normal weight, and exercise is very important maneuver for avoiding diabetes.
Walking for 30 minutes?
Yeah, this is the minimum. Walking moderate intensity, 30 minutes every 5 days, a minimum of 5 days per week. That is the minimum the person can do to avoid diabetes. Eating healthy food. When we tell person that you need diet, they think that we're telling them not to eat, not to eat, not to eat. It's not like this. It's changing the content of diet to become a healthy diet. And most of the time we say that food cooked within the house are always healthy, because you know how to cook, and most of the time you avoid fatty food, and it will contain vegetables, it will contain different ingredients which are more healthy than the fast food. Fast food is really a very heavy food, fatty food, and it's not only sugar which affect which may affect the person to have diabetes, but also fatty food, because the fat are converted into in our body into fatty acids, and fatty acids will impair the function of the pancreas. So both sugary food and fatty food are not healthy food. So as you said, we should start from at least from the new generation, and we have to make them use for the healthy food. That is one factor. Also encourage our children to participate more in physical activity. The new generation are becoming more sedentary, sitting, watching TV, playing with different electronic games, and if we compare them with the previous generation, they're really not moving, they're really not doing enough exercises. And the children by nature, they are active, but because of the changes in life style, they became less active than before.
Definitely, I agree with you, Dr. Safia. But also what I'd like to ask you is there a difference between children's diabetes and adults with diabetes?
Yeah, that is type 1 in children. As I mentioned before, type 1 appears more in children than type 2. But because of increasing obesity in children nowadays, we see even type 2 in children, which used to be very rare before.
And this is all down to lifestyle choices and changes.
We call them lifestyle diseases like hypertension, diabetes, hyperlipidemia, are all these lifestyle diseases.
And so many of them, as you said before, can be changed or prevented by having the correct amount of exercise and eating the right amount of foods and not being obese, etc. So also, Dr. Safia, what sort of healthy or special eating habits should diabetic people have? What sort of food should they be eating?
There is a misconception that diabetic patients should not eat carbohydrate or sugar at all. No, it is the same percentage. a diet should contain 55 to 60% of the calories coming from carbohydrate and sugar, because brain depends on sugar as a fuel. So we need that amount, but we need first of all to control the amount. Second, the quality, not only the quantity but also the quality of food. Third one is that the habit of eating just like an open buffet is not correct. We have to have 3 meals, and if we want to eat, 3 snacks in between them. But if you see nowadays, people are just whenever they like, they go and eat, they drink juice, they drink sodas, they go out and eat junk food, chips, and all of this sort of unhealthy habit.
Absolutely.
I agree 100%, of course, and commenting on, of course, the new generation currently, of course, not being so, let me say, of course, physically active, let me say, of course, technology-wise, as you mentioned now currently, anywhere you go, of course, there's a fast food restaurant, or as you mentioned,
right.
Of course, junk food. So this is, I think, of course, part of what's going on currently, and lifestyle itself. They say also that a huge, let me say, of course, effect, or that will get you diabetes is having an unhealthy lifestyle, and also being, for example, not in a good mood all the time, pressure of life itself, issues in life. This also, I think, affect on the person, of course, on my lifestyle. In this program, how will you also fight this section? Because some of course get it from unhealthy lifestyle, as you mentioned, obesity, of course, not being physically active a lot, but others, and also a big percentage currently, the effect of life. Mostly it's always financial issues, family issues. I'm thinking too much, I'm not happy enough. Then I mean, you see lots of young, let me say, men and women actually getting diabetes at such a young age, 29, 30, 31. And this, of course, is it a fact that, you know, the pressure of life itself, not being, let me say, of course, relaxed or happy all the time, could get me also the diabetes?
Unfortunately, diabetes doesn't spare anybody, doesn't spare any age, doesn't spare gender, specific gender, and doesn't, it affects both rich as well as poor people. It's all over across the population. So it's a disease which affects everybody. And as you rightly mentioned in the beginning, that these campaigns should start from the young generation, because we want to build a healthy generation. Those who are affected, already affected, we want to control the disease in them, so to prevent further damage. But those who are not affected, I think we should start from early childhood, from the house. We should start from the house. The parents, the mother and the father start changing the thinking of their children towards healthy life. And we should also do campaigns in school. In fact, several hospitals and centers, they started, they had several campaigns in school, in female school and in boys' school. Also, a few, in the beginning of this year, there was a big conference, international conference, in collaboration with the WHO and the International Diabetes Federation and the Arab leaders, like the ministers of education, ministers of health. They gathered together and for this particular problem, lifestyle diseases, and they came up with, in fact, it was initiated by His Excellence himself, that conference, and they came with very good recommendation. It's not, they invited, as I mentioned, the ministers of health, ministers of education, ministers of trade and commerce. They also invited the minister of food and agriculture, because just Ministry of Health cannot work alone. We need the cooperation of everybody, and it was really very beautiful conference. So they came with good recommendation, and we should target the young generation really for the change. Lifestyle change is one of the difficult issue in the medical field.
I agree with you. But Dr. Safia, what I'd like to ask you as well is, for instance, how should people be checking their blood glucose levels?
Yeah.
How do they do that? Yeah.
They can do it by simply by a glucometer. A glucometer is a small instrument which come with a prick of finger. You can with a drop of blood you can measure the blood glucose, but that is not always confirmatory. So the proper way to diagnose a person with diabetes is to take a small amount of blood in the lab in the hospital, and that will give you the result whether you have diabetes or not. And we have different, first of all, different blood tests. One is when the person is fasting overnight, and they test the blood glucose, or it is the blood glucose can be tested randomly. So if it is more than 200, it is diabetes. If at any time of the day with no relation to food, it can be done. So whom we should test? We should test anybody who have a predisposing factor, a factor which push him to diabetes. Like if I have my parent or my sisters or brother have diabetes, I have to go to check it. Or during pregnancy, always we check blood glucose. And if the patient has symptoms, if the person has symptoms like drinking a lot, feeling thirsty a lot, losing weight, in that case we have to do blood sugar level.
Okay. So these are the symptoms that you just mentioned, is losing weight, and
yeah, these are the symptoms.
Repeat the symptoms, please, doctor.
Yes.
If you could repeat the symptoms.
The person will feel thirsty, drink a lot, and they have lots of urination, and they lose weight. But unfortunately, 50% of the people, half of the people, they do not have these symptoms. So half of the people who are diagnosed to have diabetes, they do not have the symptoms.
And in fact, a lot of the people who have diabetes have remained undiagnosed. What is the percentage of people who probably have diabetes and just don't know that they have it?
50% of the people. So if we say 28% of people above the age of 30, they have diabetes. Another 28%, they have the diabetes, but nobody knew about them. Nobody know about them.
It's definitely a big number. I think awareness-wise also should be there. Of course, such campaigns. I think it's a great thing. First of all, towards society, and towards humans in general. I think, of course, it's definitely a great approach from yourself, and of course, the program itself. But Dr. Safia الشربيني, I'd like to thank you so much. It was a pleasure. It was educational. We enjoyed it, of course, and of course, we learned a lot today, of course, about diabetes, and hopefully, we could be part of this, let me say, of course, awareness program, whether it was, of course, as media personnel, or as, of course, human beings in general. Thank you.
Thank you very much. My pleasure.
Thanks a lot. Dear viewers, small report. After that, we'll be back with a new guest, so stay tuned.